No nonsense. Hello, and welcome to another episode of No Nonsense Psychiatry. And this will be episode number 3. And as I've said in previous episodes, that I'd like to just recap over episode 1 and 2 today, just so for the people that are joining us for the first time, kind of have a little bit of an idea of where the show's going. It is a psychiatric and mental health podcast, show, whatever you want to call it, but it is also very relevant for you to understand where we're actually coming from. So initially I was talking about the fact that I wanted a no-nonsense approach to psychiatric advice and helping others to move forward, really. And moving away from traditional psychiatry of talking about your past and a patient going away and working out for themselves, where they think they should go, and then bring that back to the psychiatrist again. This is more about practical advice, tools, which will be able to be used in your everyday life. And giving you that little bit of confidence to see that you can actually, work things out with some support by yourself, which sounds a bit contradictory, but I think human nature is that I think things work better when we work in groups. And also, I guess the whole point of the show is to empower you really as the person, and to build on your own progress and stay in control of your own progress as well, and finding that kind of safe and supportive space. In the last episode 2, we talked about the potential downsides of solving problems by ourselves, and we looked at various things that can happen to people that are trying to work things out for themselves. And then we looked at some hard truths about doing it yourself with the support of others, and what that can actually look like as well for you. And there was various points there, positive and negative, that kind of put in perspective what a person may be going through, whatever it might be, at a level where they feel that they need to get some help around their mental health as such. So today's episode, we're going to be talking about traditional psychiatry and looking at the pros and cons of that. And if we get time, we're going to talk about what counts as a severe mental health condition, because you'll hear that quite a lot from now on. And I think it's important to really understand what that means and what that means to you when you're facing problems and trying to gain support. I think, as I've said to people before, I think people have some very, very real problems that play on their mental health, as we like to call it nowadays. But we used to call it impacting on your everyday life, and issues that would do that. And they're very real things to people, and they do affect how we function, and they affect our relationships, our works, and also our well-being, and how we think and feel. And I think there's a massive difference between that and having a severe mental health condition, which I think is very, very different from what this show is trying to aim at. I guess for people that have that, and I'll explain what a severe mental health condition is to you a bit later, but I guess people that have that type of condition, they rightly need the assistance of a psychiatrist, and they rightly need the support of a mental health team to support them to function in their everyday life. But I think for the rest of us, even though it can be quite, I'm going to use the word disabling, which will probably offend people, but I think it does disable people, is our everyday consequences of being a human being, and what that can mean sometimes. And I think we don't really need to be involving the mental health community services in those type of problems, because there is many other supports out there, and one of the biggest supports that you can get is yourself, and how you think and feel. So that's my opinion of it anyway. Right or wrong, I'm sure some people wouldn't agree with me, and I'm sure there's people out there that would agree with me, and that's not really up for debate. Really, I'm just offering my opinion of how I've seen things unfold in the last 20 years, I guess, with the mental health system that people talk about being broken. I think the reason for that is that it's still set up for a very traditional psychiatric foundation, which I think can be really, or give the appearance of being really unsupportive to a lot of people. And that's because it's not set up to deal with real everyday life issues that people have, and how to support them work through those issues. And it's not very helpful when you're a person that's struggling financially, or struggling with a relationship, or in a job you don't like, or feeling lost in the world, have no friends, have addictions, whatever it might be, everyday stuff, real stuff. When I say real, not a hallucination, not a delusional condition. We're talking about real things that people really feel every day, that everybody does. I think this show is kind of aimed at that. Okay, so traditional psychiatry, the pros and cons. Yeah. So really, when you look at traditional psychiatry, it's very subjective of diagnosis. So it's going to rely on subjective judgments rather than objective biological tests. Okay, what does that mean? Well, what that means is that, when somebody presents with a mixed bag of symptoms, you can't just whack that person on a machine and press the button and suddenly, with a heart rate monitor, it can tell you the pulse, it can tell you the heart rate, it can tell you the blood pressure, and it can tell you the oxygen saturation, and it can give you some audible sounds as well, and you can sort of see if somebody's heart rate is fast. You can hear it, you can see it. With psychiatry, you kind of can't whack a little thing on the brain and see, that section C is not working very well. That seems to be low. We seem to have low dopamine levels and stuff like that. So when they say subjective, they kind of look at this. They look at the symptoms that the person has, and they subjectively offer a view on it. It's an objective view because they're only going to say what they see, but also there's going to be subjectivity in there where they can kind of guess where that person's going to go. And then sometimes that could lead to misdiagnosis or the wrong treatment being offered. And that's not uncommon to say that, but because, we can't read minds, can we? We can only guess, I guess, if you want to put it into a word. You can only guess through a set of symptoms, matching them up with another set of symptoms, which gives you a reference, i.e. the diagnostic journals that are available for psychiatrists and psych registrars to diagnose, if you like. So, without having a great understanding of that or lots of exposure to mental health, we can sometimes get people diagnosed with conditions that perhaps are questionable, and then eventually, you might be given the wrong treatment. And when I say wrong treatment, certain, so for instance, that there's a whole plethora of antidepressants, for instance, and not every one of those is going to treat the condition the same way. Some are better taken in the morning, some are better taken at night, and there's reasons for that, which we can go into in later shows. but some medications work better with levels of anxiety, but then on another person it might work better with irritability or sleep or something like that. So they're kind of not guessing, but they kind of look at the one that with exposure and experience, they kind of pick the one that kind of works as a generic, a bit like getting an antibiotic. You might have a generic antibiotic to treat an infection, but then find out that it's not really doing much for the infection, so they increase the dose of the antibiotic and use a more strong one. And that kind of does happen in psychiatry as well, but you need time to actually see the results. So that's what I'm talking about. It's not like a biological test where you can sort of say, yeah, this person has that. Obviously, with medications, taking medications, there is the chance that you're going to suffer some side effects from that. And that could be anything from feeling sick in the stomach to insomnia. And there's reasons to why that happens as well. So you've got those kind of things going on. For most people do get the more common side effects that usually wear off the more you take the medication, because it's building up to some sort of therapeutic level. But in others, there's medications that can cause issues like weight gain, which is something people get really upset about, because a lot of people are very focused on how they look and how they feel about themselves, and people don't want to feel overweight. So, you have those issues as well. And even with some medications, they can actually make you feel quite suicidal, if you like. They've been prone to do that. People have experienced that. So again, these are things that you need to think about with traditional psychiatry. Controversial past, I guess. Some treatments from the past, like electric convulsive therapy or lobotomies, have kind of caused this kind of legacy on mental health and added to the stigma of being what people feel about mental health. Even though things like ECT or electric convulsive therapy is still used today, lobotomies, as far as I'm aware, are not, and I'm pretty hopeful they're not. But ECT has sometimes been very, very helpful for some people. But initially, when it was being trialled, I guess, there was lots of guesswork involved with how long someone has their brain have electricity pass through their brain to reset it, if you like. How long do you actually do that for? And, is enough type thing. So again, it's controversial, I guess. There are other things that you can treat depression with nowadays, which we'll go into at some point. And I guess medicalizing things is kind of normal, Sometimes psychiatric labels it labels normal experiences as illness, and sometimes that gets leading to unnecessary treatment and stigma. I think a good one at the moment is adjustment disorder, which in my opinion, yes, there's probably a lot more to it than what the actual title is, but adjustment disorder is people that don't like change, and they react quite negatively to change, and they don't like it. And, adjustment disorder is suddenly a medical term. ADHD in girls as young children, well, girls were called chatterboxes, and so look, it's all very subjective, I guess. It's my opinion at the end of the day, and that's how I see it. So you've got that kind of stigma around treatment as well. There's the ethical concerns around using traditional psychiatry, and there are real worries about using diagnosis and treatment for control, like detaining people for treatment without their consent. And, I often experience people sort of ringing up saying, oh, this person needs to go to hospital, and, this person needs to be in hospital, they need treatment. And, I get it that whatever's happening in the home is overwhelming for them. But, the days of locking people up because other people have said so, that can also be used divisively, and you've got to be quite careful with that as well. Taking someone off to hospital and manhandling them, doing that is it's the same as kidnapping and abduction. You need legal reasons why you can do that, and the Mental Health Act is very, very clear about those things. And again, that's something we can go into later. It's another large area which can be discussed. So I won't talk about that too much, but you do have those issues as well. And then there's evidence issues as well. So some critics say that the mental health industry sometimes makes claims about being evidence-based without any scientific backing. And what does that mean? What does that mean to actually say that? It's saying that, it's evidence-based. Lots of drug companies will claim that medication works on certain receptors in the brain, and they come in with diagrams, and they sort of tell you what happens and how it works on it. Where really, as I was saying before, there isn't anything that can kind of contain and give some sort of definite overall picture. This person is schizophrenic. You could look at larger enlarged ventricles in the brain and all sorts of things like that. But that takes a lot of testing to actually do that. Some people are actually given a diagnosis of schizophrenia without any of that medical evidence. So it's not always evidence-based, even though for the majority it is. And then you have to question the ethics around why people report certain things work a certain way. I mean, the conspiracy theory would say that, drug companies only finance testing facilities that test in favour of their products. It's questionable, isn't it? Traditional psychiatry offers structured, research-backed treatments that truly help manage symptoms and improve quality of life. Absolutely. That is also the opposite end of the scale of saying that, the medical industry sometimes claims things that are not evidence-based. There are things that do help with severe and enduring mental health conditions or severe mental health conditions. Or what we used to call Access 1 diagnosis, which means that they have they meet a particular criteria that people would be like this regardless of whatever they were doing. That this is like a biological a reason for people being unwell, and then there's medications that will reduce symptoms for that, which is very, very true, and we'll go into those. And for some people, medications are crucial. They stabilise mood, reduce symptoms, and they prevent relapses in severe cases. Well, I would say they probably push relapses further apart. I wouldn't say that they prevent them. They probably can prevent the severity and the ongoing sort of occurrence of relapses, as I say, pushing those episodes of relapse further apart, but definitely reduce symptoms of psychosis, say for instance, or if they have an actual mood disorder, bipolar affective disorder, it can try and level out that mood so people don't have such extreme highs and extreme lows. They might be a little bit more balanced, but then that comes with this goes back to side effects as well. That comes with other indications which also can happen to the person, which can make them non-compliant, but we won't go into that today. With traditional psychiatry, you do have access to proven therapies like CBT, and they really do work. CBT is another medicalized, I guess, form of treatment, which for a lot of people is looking at the way you think, the way you feel, and the way you behave, and trying to, I guess, rewire the brain to think that way automatically, and that takes a lot of effort and a skilled clinician to actually work with you to keep you on track as well. And obviously the field of psychiatry is evolving. People say that it's advanced, but it was only just over 100 years ago we were locking up people for being unruly. So yes, there is advancements. We don't do that anymore. At least I hope we don't. But again, there's always going to be better and newer treatments coming out that will have less and fewer side effects, which would be really, really good. And for those in crisis, traditional psychiatry provides immediate care and symptom relief, which is sometimes exactly what we need. And in crisis, that's absolutely true. If it's what I said to you in a previous episode, that if you're feeling like you don't want to be around anymore, the emergency department's probably the best place for you to go, because not everybody really wants to end their life, but when they feel that they haven't got any options, that may be something that becomes more prominent in their mind, and they may be unfortunate enough to actually to do that, or attempt that, or plan that, which is pretty frightening within itself. And obviously, a structured approach means that you get comprehensive assessment, leading to a much more accurate diagnosis and tailored treatments. So you do get that with traditional psychiatry. Again, for someone that's got a severe mental health condition, that's perfect, because they're going to get an assessment. Sometimes it's going to be an assessment which might include an assessment of a hospital admission, where they can look at someone over a longer period or without any illicit substances in their body, to actually see what's actually really going on, and then offering the right treatment. And you may find out that the right treatment might be no treatment. It may be all to do with drugs and using illicit substances like ice. And then once that ice is, out of the system per se, those symptoms of psychosis may not be there anymore. And then obviously, when you've got like a traditional psychiatric assessment, you might get a combination of medication, which is normally the case, because you've got to think about it really. Is that sometimes we want to decrease the anxiety, so we might use medication that calms you down, or acts as a muscle relaxant, but it might make you feel a bit tired. So you might actually have that treatment maybe early in the mornings, at night times, to help you sleep. And then obviously continues to work at a less aggressive pace, I guess, during the day. And there is a huge amount of research and clinical trials backing up traditional psychiatric methods. And that is so true. There is lots of evidence to say that these things do work. But again, depending on who's interpreting it, that will kind of weigh on the outcome as well, and the reasons why they're interpreting it that way. I think that was actually a lot more of a bigger show. I think it's gone on about 4 or 5 minutes more than what the other two shows have gone on. And I think there's a good reason for that, because I think people need to really understand, and you might want to listen to this a couple of times just to sort of get it right in your mind. And what I'll do in the next show is I'll talk about what severe mental conditions are, so that you don't confuse that with when you want to see a psychiatrist. There may be a case that you don't actually need to see a psychiatrist, because a psychiatrist isn't going to really make anything better for you in the short term. What you might need is some quick tools to actually help you plan and organise yourself a little bit better, so that you don't feel so stressed. It could be just that, for instance. So anyway, I'll do that in the next show, and I really, really hope you enjoyed today's show, and I hope that you got something out of it. Please subscribe to my channel at YouTube. If you like the show and you think someone else might benefit from it, share it around. I don't mind. Anybody that wants to email me or anything, there's an email address on there as well. Or you can Facebook me, even if you want to tell me that I'm talking rubbish. Any feedback would be great. So till the next time, see you later for No Nonsense Psychiatry. No nonsense.